All right, everyone, let's test your clinical thinking. A patient arrives in the emergency unit with suspected stroke. What test should be carried out first?
CT scan.
That's not the correct answer, but you're close.
Close?
Maybe an MRI or ultrasound?
CT scan is essential, yes. But hypoglycemia can present exactly like a stroke, weakness, confusion, even unconsciousness, if you miss simple treatment and risk harming the patient.
So, blood glucose helps us avoid misdiagnosis? Exactly.
Always check and correct glucose first, because it's fast, life-saving, then proceed to CT scan to confirm stroke and guide further treatment. In emergency care, always rule out what you can fix immediately before chasing what you can only confirm. All right, everyone, let's see how sharp your clinical instincts are today. The nurse observes that an older adult client with a urinary tract infection, a UTI, suddenly becomes agitated. Which immediate action is best? What do you think?
I think notify the doctor.
All right, let's pause. A, lorazepam. It treats agitation, but it hides the underlying cause. B, notifying the provider is important, but not the first step. The correct answer is C. Check the client's vital signs. Sudden agitation in older adults, possible delirium from infection. It could mean worsening UTI, sepsis, hypoxia. Vital signs tell you what's happening right now. In nursing, the first step isn't to react. It's to assess what can harm your patient immediately. So the correct answer is C. Always assess first before intervening or notifying. Many student nurses think pyrexia and hyperthermia mean the same thing, but that's very wrong.
Do they both mean high temperature?
Yes, but the cause and the treatment are completely different.
Pyrexia is a fever caused by infection or inflammation. The body intentionally raises its temperature to fight illness.
Hyperthermia is different. It happens when the body overheats and cannot cool itself, like heat stroke.
So the treatment must be different.
Exactly. That's why it's crucial not to mix them up. Pyrexia is treated with antipyretics. Hyperthermia requires urgent cooling. Don't just treat the temperature. Understand why it's happening.